Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McRae.
Tracy, did you realize that it is National Kidney Month?
No idea.
But you've been around long enough to know that it's probably a good idea for all of us to give our kidneys a second thought and a well-deserved checkup.
Attention to the kidneys is always a good thing, yes.
Well, you're right. There aren't too many organs that are in your body that are more important than your kidneys. Actually, you can't live without your kidneys. You can live with one, but you can't live with none. Well, I guess you can live without your kidneys, with no kidneys, but it's pretty difficult. Your kidneys are pretty amazing. They filter over 50 gallons of blood every day. They regulate blood pressure. They get rid of whatever your body doesn't need, toxins in your body. They're sort of the garbage collector of the body. They produce an active form of vitamin D, and they control the production of red blood cells, and I'm sure I missed something.
Well, unfortunately, they're also prone to disease. 1 in 3 Americans is at risk for kidney disease due to diabetes, high blood pressure, or a family history of kidney failure. There are more than 30 million Americans who already have kidney disease, and most don't even know it. It's time to focus on the kidneys. Joining us in studio is a Mayo Clinic kidney specialist, Dr. Ladan Zand. Welcome to the program, Dr. Zand. It's nice to meet you.
Thanks for having me. Nice to meet you as well.
Dr. Ladan Zand, nice to have you. You have a little bit of an accent. I can tell you're not from Iowa.
I'm not, yes.
Where are you from?
Originally Persian.
Persian.
Yes.
And then how did you end up at the Mayo Clinic?
Well, I came to Canada for my training for undergraduate and for medical school, and then I decided to come to Mayo Clinic for my residency training, and then I stayed on for my nephrology fellowship, and then on staff now for the last 4 to 5 years.
So you're a kidney expert.
Well, what got you interested in working with kidneys?
It actually started in medical school. I was fascinated by the pathophysiology of kidney disease in general. And after I got a chance to work with patients, I found it very rewarding. I specialize in a specific type of kidney disease, which is the inflammatory conditions in the kidney called glomerulonephritis. And I find that very satisfying. These are patients with acute kidney issues that you can help, and has been very gratifying.
You know, it almost sounds like there is an epidemic of kidney disease, not in the United States, but not just in the United States, but the world. 30 million people in this country have kidney disease, and most don't know it.
That's absolutely correct. Part of that is because certain diseases such as diabetes and hypertension increase your risk of developing kidney disease. And in addition to obesity, and it seems that obesity and diabetes have been on the rise, and that may be partly because the reason to see more prevalence of kidney disease.
Well, luckily we have 2 kidneys. So if you have kidney disease, I don't know, do both kidneys get affected? First of all, why do we have 2 kidneys?
That's an excellent question. You know, I think that's sort of the nature's way. You're born with more function that you need. And the thought is that perhaps if you had an injury down the line, that you have enough reserve to be able to survive that injury. But in adults, most should be able to live with 1 kidney. And I always think of it's a good way to be able to donate a kidney if you're healthy enough. But majority of the times, if you have a disease in the kidney, it does affect both. Rare situations, you may have it in 1 kidney, but usually in both kidneys are affected.
And if you do donate a kidney, isn't it true that it does not shorten your life expectancy? So you can easily live with 1 as long as it's healthy.
That's absolutely correct. You usually go through a very thorough evaluation for the transplantation to be healthy enough to donate. But if you do meet the criteria that you're healthy, no other health issues, donating 1 does not shorten your lifespan.
You mentioned a couple of the risk factors, diabetes and obesity, high blood pressure being another one. But how do those diseases affect the kidneys?
The diabetes itself has been, I would say, is one of the most common causes to affect the kidneys, and that has to do with damage to the lining of the blood vessels in the kidney, so the endothelial cells, as we call them, and it has to do with the elevated blood sugars, and that usually ends up having consequences that lead to kidney disease. You may notice that when you're born, your kidneys are made of a couple of millions of little tiny filters that we call nephron. And usually if you start losing some of these nephrons, that adds extra pressure on the remaining units. And over time, that may lead to scarring, which ends up being sort of the final pathway for, regardless of what the cause of the kidney disease was in the first place.
And then obesity is sort of an indirect risk factor in that obesity A lot of people who are obese have diabetes, and it's really the diabetes that affects the blood vessels and the blood flow to the kidneys.
So that's correct. That is one mechanism by which obesity causes kidney disease, but there is actually growing evidence that obesity alone in the absence of diabetes or hypertension can cause kidney disease. And there's this new terminology they call obesity-related kidney disease. And I always think of that your kidneys are made for ideal body weight. And if your weight is above what's kind of considered ideal, that increases the pressure on the kidney or the work on the kidney. And over time, you may wear these tiny little filters or nephrons out, and that increases your risk of kidney disease.
Because if you're bigger, you have more stuff to filter, so your kidneys have to work harder.
That's exactly correct. Yeah.
So obesity in and of itself is a risk factor for kidney disease.
Correct, yes.
And high blood pressure. Talk a little bit about that.
So high blood pressure has always been considered a risk for kidney disease, but a lot of times there has been this argument in the nephrology community of chicken or egg, because the kidney, if you have kidney disease, you would also be at high risk of developing high blood pressure, because the kidney's job is to get rid of salt and water. And so whether hypertension alone on itself develops kidney disease, or is there underlying kidney disease that subsequently increases the blood pressure and that results in progression of kidney disease, has been debated. But I always think of hypertension more in the category of vascular disease. So if you have history of smoking, high cholesterol, that again results in damage to the lining of the blood vessels, increases stiffening of your arteries, decreased blood flow to the kidney, and scarring in the kidney and kidney disease.
So in your opinion, the high blood pressure is the culprit, not the kidney. But you're a kidney doctor.
If there's 30 million Americans that have kidney disease, and so many of us don't know it, what are some of the symptoms that you have kidney disease?
That's what makes diagnosing kidney disease very difficult. I would say majority of the times you would be asymptomatic, meaning that you will not have any symptoms of kidney disease until you have lost a fair amount of your function. Usually by the time you develop the symptoms, your kidney disease is probably pretty advanced. And that's partly because your kidney is able to compensate pretty effectively till late stages. But usually some of the signs and symptoms include, one of the main one is evidence of fluid retention. So it would be swelling in the legs, sometimes would be swelling in the face, difficulty breathing. These are all signs that you're retaining fluid that your kidney is not able to get rid of. Other ones would include evidence of toxins accumulating in your body, and that could be somewhat non-specific, but could be decreased appetite, difficulty sleeping, difficulty concentrating, sometimes itchiness of your skin, and these are all results of the toxins building up.
So if the symptoms don't come until it's almost too late to save your kidneys, should you be screened? Should the kidneys be screened in screening tests?
I think if you're considered at risk population, you definitely should be screened. For general population, it's not advised necessarily, but definitely if you have a diagnosis of diabetes, if you have a diagnosis of hypertension, you are overweight, if you have family history of kidney disease, you definitely need to be screened. And also certain ethnicities are at higher risk. So for example, African Americans are higher risk, American Indians are higher risk. And so if you fall in that high risk category, you should be screened, yes.
Are there any changes in your urine that might suggest you have a kidney problem? I'm thinking of bubbles.
Yes. So that pretty much may be one of the signs. So bubbles or foaminess of the urine is usually a sign that you're leaking protein, usually actually a fair amount of protein to see the foaminess. Sometimes dark urine may be something you may see. That may be a sign that there's blood in the urine, but changes in your and sometimes also overnight, if you get up to go to the bathroom frequently, sometimes you may see that in patients with kidney disease because of the fluid retention, and then you may have to get up more often overnight. So those are non-specific, but related.
There are a few symptoms,
yes.
But the best thing, if you have one of the risk factors, you ought to get screened for kidney disease.
Correct.
All right, and we know those risk factors are diabetes, high blood pressure, obesity, and a family history of kidney disease. Yes. We're talking with Mayo Clinic kidney specialist, Dr. Ladan Zand. Time for a short break. When we come back, more on kidney disease, including dialysis and transplantation, plus tips on how to keep your kidneys healthy. Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
It is National Kidney Month, and World Kidney Day is this week, March 14th. Our guest is a kidney specialist, Dr. Ladan Zand. Dr. Zand, we learned a lot about kidney disease, common types of kidney disease, symptoms, screening tests. But now tell us what happens if your kidneys completely fail. What are your options?
So we consider that end-stage renal disease, and if that happens, usually we consider three choices moving forward. One would be option of kidney transplantation. Another would be option of dialysis, and there are different modalities of dialysis. And the last option would be what's considered medical management, and not pursuing either dialysis or transplant, and just continuing with medical care.
So let's talk about dialysis, because I think there are two types of dialysis. It's difficult for anybody to go through this. But talk first about peritoneal dialysis and then hemo.
Sure, yeah. So the peritoneal and hemodialysis are the two main modalities. The peritoneal dialysis is a method where you put fluid inside your abdomen, and your lining of your abdomen essentially works like a filter where it exchanges the toxins essentially from your blood come into that fluid, and then eventually you drain that fluid off. The nice thing about peritoneal dialysis is that you perform that at home, and you have the option of either doing it continuous throughout the day, or most commonly people do it essentially overnight when they go to sleep. And it seems to be the least disruptive to your day-to-day routine.
Pretty amazing. Whoever figured out if you put a bunch of fluid in your abdomen that it would work like the kidneys?
Yeah.
Yeah, somebody pretty smart. So do you need a helper to do this, or people who live alone can do this?
You don't need to have a helper for peritoneal dialysis. You have to go through a training to be able to do that safely and essentially in a sterile fashion, so clean enough so you're not at risk of developing infection. But you can do it at home by yourself.
Every day?
Essentially every day, yeah.
Yeah, that's got to be... That's hard. That has to be what wears on the patients.
Yes, absolutely. To be honest, regardless of the modality of dialysis, it's very hard. Whether it's peritoneal dialysis or hemodialysis, it can be very taxing on both the patient and their family.
So what is hemodialysis?
So hemodialysis is when you take the blood out of the patient and put it through a machine called the dialysis machine, and it's the machine's job to essentially take the extra fluid off and clean the blood as it goes through a filter, and then return it back to the patient. And with hemodialysis, you need to, obviously, because you're taking the blood out of the patient, you do have some type of what we call an access, whether it would be a what's called a fistula, which is a vein that's enlarged, so you can put needles in there so you can take the blood out of the patient. And less commonly, there's a catheter that we can use in more urgent situations where you can take the blood out of the patient and run it through the filter. And we have two types of hemodialysis. One is what's considered in-center, where you go to a center to do your dialysis. And another modality is the home hemodialysis, where you actually do the hemodialysis at home. There's a smaller machine you have, and with that you do it usually 5 times a week or so. But it allows you more flexibility essentially, where you can do it at home.
Really? I would assume that the home machine is fairly expensive?
So it actually would be free of charge for the patient. You would not have to pay for the machine. It would be covered.
No, well, perfect. I like that, huh?
I know, but the thing about it is, anybody I know who's done dialysis, it just is, like you said, it just drains on you. Mm-hmm. And so if you get to a point where dialysis no longer works, does dialysis take a toll on the kidney as well?
So usually when we consider starting the option of dialysis, we're thinking that you're in a point that your kidneys can no longer do the function. Now, can you lose some of your residual function as you go on dialysis? That does happen over time, but we always think that it just essentially replaces your kidney to do the job of the kidney.
So then transplant is your only other option.
Yes, and I also want to add that you don't necessarily need to go on dialysis to be able to qualify for transplant. We actually always advocate for what we call pre-emptive transplant, meaning that before you go on dialysis, that you do explore the option of transplant. And in fact, if your kidney function is low enough that you don't need dialysis but meets a certain cutoff, you would be eligible for transplantation. And we do know that the outcomes, patient survival is much better on transplant, so is the quality of life.
If are most of the patients who are on dialysis, are they kidney transplant patients, or are a fair number of them just too ill to even be considered for a transplant?
I would say fair number of them are too ill to be considered for transplant. Now, there are patients that are eligible for transplant, but they don't have any what we consider living donors, so they're waiting for a kidney to become available for them, and during that time, they have to be bridged with dialysis in order to get a call for a kidney transplant. But many of the times, they're maybe too ill to be considered for kidney transplant.
So, what do you do if you can't get a kidney transplant? It's just dialysis and that's it?
It's dialysis.
How many
Keep
people?
going to the dialysis center, I guess.
Yeah.
If you are on the transplant list, if you can, you're better off to find a living donor as opposed to a deceased donor, right? Because isn't the success rate a little bit better with a living donor?
The success rate is better with the living donor, and also there is no wait time. Usually, if you're approved for a transplant and so is your donor, usually that can move ahead pretty quickly.
The final thing we want to talk about is what we can do for our kidneys to keep them healthy, because none of this sounds very appealing, dialysis or a transplant.
No, I'm not in favor of any of it.
You're absolutely right. The best thing to do is to keep your kidneys healthy. And some of the tips I would have, one would be to make sure that your blood pressure is well controlled and have that checked. Making sure that your blood sugar, your blood glucose is also well under control, and that you get screened for possibility of diabetes. Keeping your weight under control is very important, and eating healthy would be important. Other tips I would have is to there's a fair amount of use of over-the-counter pain medicine, specifically non-steroidal anti-inflammatories, and those can, if used heavily, can be harmful to the kidney. So we say to be cautious with the use of those medications.
Smoking, you must.
Yes, absolutely. I'm glad you brought that up. Yes, avoiding, if you're a smoker, smoking cessation, or obviously not picking up the habit of smoking, that would be also very important.
Are there any foods that are bad for your kidneys? Now, it was an old wives' tale. When I was growing up, my brother, he loved mustard, and my mom said, "Don't use too much mustard. It's hard on your kidneys."
Not that I know of. No.
Are there any foods that are not good for your kidneys that you know of?
Not per se a food group that's not good. I mean, usually the salt is something that we say you would want to watch. And obviously foods that are high in fat and whatnot have other risks that, can increase your risk of, hyperlipidemia and vascular disease. But no particular food per se that I can think would be harmful.
All the mustard you want.
I'm going to tell my brother.
You've got some ground to make up.
Yeah. I hope he doesn't have any kidney disease. My mom might have been right. Moms are always right.
Yeah, right.
Well, a lot of reasons for a kidney checkup this month. It is National Kidney Month, and March 14th is World Kidney Day. So especially if you have one of the risk factors that we talked about, diabetes, high blood pressure, a family history of kidney disease, get screened today. A special thanks to our guest, kidney specialist, Dr. Ladan Zand. Dr. Zand, you were terrific. Thanks for being with us.
Thanks for having me. Thank you.